Hi everyone, welcome back. So today I am doing another sports related post and I'm going to be talking about the most common injuries in weightlifting and also how you can prevent these injuries. So I think, the way that we perform exercises of any kind is certainly going to contribute to, whether or not we get an injury. And I think, not for everyone, but, certainly for some people, it's human nature to look for the easy way to do things. And most of the time, when we sort of go with the easy route, we end up in some way compensating. And what happens is that these compensations in terms of muscle tissue will cause excessive strain on other parts of the body, which can then lead on to other common injuries. So it's not really an easy option. So I'm going to look at some of the most common injuries that I see as a sports therapist, and certainly common injuries with those of you that are doing weightlifting on a regular basis. So the first injury that we're going to talk about is shoulder impingement. And I will be doing a specific video on shoulder impingement in the future, so keep an eye out for that one, or alternatively subscribe to my channel and you'll be notified when it comes out. With shoulder impingement, you're really looking at any activity where there's going to be lifting weights overhead. So things like bench and shoulder presses, lateral raises, if you're using dumbbells. These are the ones that can result in shoulder impingement, which can also, sometimes you might have heard it referred to as swimmer's shoulder, because it's common in swimmers. And again, when they're doing this sort of overhead movement, that's going to be repetitive movements on the shoulder joint. So with shoulder impingement, which is not pleasant because I've had it myself, you're looking, in terms of the muscles, you're looking at the rotator cuffs, which is a group of muscles and tendons that basically attach your upper arm to your shoulder. And so they will help you not only lift your arm, but also, rotate your arm as well. And certainly one of the symptoms with shoulder impingement is when you raise the arm up and it's sort of slightly rotated. That's when you're going to feel a lot of weakness and pain around that shoulder. But I will cover that in more detail when I do the shoulder impingement post. So if you have shoulder impingement, what happens is that these rotator cuff muscles will rub against the top of your shoulder, so that when you lift your arm, the space between the muscle and the bone across the top of your shoulder will narrow, and so this then increases the pressure in that area, which can cause friction and irritate the rotator cuff muscles, which then leads to your shoulder impingement. So the main symptoms of shoulder impingement, you will experience a sudden pain in your shoulder, as I've said, when you lift the arm overhead or backwards, and when there's some form of rotation in the arm. You will probably find that the pain may get worse at night, and certainly if you're someone who sleeps on their side, this could prove to be an issue. So as hard as it is, you may want to start considering lying on your back. You will experience weakness in the shoulder and also in the arm. Certainly for me, I found that doing the lateral raises with dumbbells was near impossible at times. So I had to kind of rethink my sort of daily exercise routine. Now, the pain may be minor, but it will probably be fairly constant. And it will usually be around the front of the shoulder, around towards the side of the arm. Okay. And I sort of had some around the back there as well. Now, mostly this pain, it's going to be caused by, basically, as with a lot of sports injuries, it's those repetitive movements and overuse. So when you're repeatedly doing the same movement, what it does is it causes the tendons in the shoulder to become inflamed, and they will then start to rub on that upper shoulder bone, which is going to make the problem even worse. So that is very briefly your shoulder impingement, but as I say, I will be talking about it in more detail in the future. So the second most common injury for weightlifters is either disc herniation or degenerative disc disease. Basically, herniations are usually caused by poor lifting technique, really, and that will be exhibited by localized back pain around the area that the disc is herniated, and I'd say usually it's in the lumbar region. And you may also get numbness and tingling, which may travel down towards the legs, because obviously, if one of your disc herniates, it could then be pressing, you've got all your central nervous system that runs along the spine, so it could then, compress a nerve somewhere, which could, cause that tingling and numbness down the leg. Degenerative disc disease is more of a common term, which is generally used to describe really just excessive wear and tear on the spine. But both the disc herniations and the degenerative disc disease, they can both be exacerbated, certainly by poor posture, when lifting weights and exercising. So that's why it's so important to be aware of your positioning and your posture and your spinal alignment and everything else when you are lifting. Because by placing your spine in the correct position, you're going to be experiencing less stress on your spine and specifically on your discs, and your core muscles will also be able to basically engage more effectively. And so when these two things happen, you're then going to be at lower risk of having an injury. So in terms of preventing one of these back problems, just do a posture check. If you stand up straight against a wall, with your back against the wall, you should have that small natural curve in the lumbar area of your spine. And so that's called a neutral spine. And that is what you need to maintain when you're doing any kind of strengthening exercise. And you can also kind of practice this by taking maybe like a broom handle or some sort of pole and, holding it behind your neck and then down behind sort of the top of your glutes, and just sort of kneel on the floor, and then you want to sort of bend towards the floor, keeping that pole in position. And you just want to do that whilst maintaining that neutral spine, maintaining that small natural curve in the lumbar region. Okay, and by practicing that will probably really help with your, your postural alignment when you're actually in the gym lifting weights. But also when you are doing lifting, just focus on, rather than bending the back, you want to focus on hinging at the hip joints, and as we said, engaging those core muscles around the abdomen as well as the back, to really just help maintain that neutral spine and maintain a good strong position while you're doing the lifting. So another common injury with weightlifting, which is something that I've also done a specific video about, is IT band syndrome. And now this is actually very common, as you'll see from the video that I've done on IT band. It's very common in runners and also cyclists. I would say that probably 9 times out of 10 when I do a sports massage on a runner, there is some tightness in the IT band. So the IT band is basically a thick fibrous band of connective tissue that runs from your glutes along the outer side of the thigh. So it runs from the hip down and crosses the outside of your knee. And if you have an injury here, or inflammation of that IT band due to, again, repetitive movements, it can cause pain, anywhere really, from your outer hip bone right down to your knee. But if you're worried about this being an issue, please look at the specific video that I've done on IT band syndrome, which will explain the causes, the symptoms, the treatment, and how to prevent it. But briefly here, in terms of preventing IT band syndrome when you're weightlifting, things to keep in mind are keeping your knees aligned with your toes. And also keeping the hips neutral. And this will help reduce the stress on that IT band. Also, doing exercises to strengthen the glutes, because obviously this is where the IT band attaches. That will help strengthen and also stabilize the hip joint and also the knee, which again is going to, take, stress off of that IT band. And I'd say while it can be really uncomfortable having your IT band massaged when it's tight, a good firm massage there can really be quite beneficial. So if you can grin and bear the discomfort for a little while, it's well worth getting a deep tissue or preferably a sports massage on that area. Okay, so the next injury that we're going to talk about is Achilles tendonitis. So, and this actually, as well as weightlifters, this is also another common injury for runners, especially if you're running uphill or on sand. And it will basically cause pain in the back part of the heel. And sort of go into the Achilles tendon at the bottom of the calf. Tendon injuries do take a long time to heal. And this is one of those injuries where you absolutely have to rest. There's no kind of, no pain, no gain, and pushing yourself through. You have to rest, in order to reduce the inflammation And then, you know, once that has subsided, to just gradually build up the strength, you know, in the calf muscles again by doing things like heel raises. And again, I will be doing a post on calf muscles and injuries, which will have some stretches, you know, that you can do to stretch the calf muscles. So keep an eye out for that. Okay, so in terms of prevention of Achilles tendonitis, really, you know, it's a case of just stretching your ankles, stretching those calf muscles regularly before and after every workout. You know, and especially sort of if you're running, before running, you know, or doing also any leg exercises which involve squatting, you know, just to really sort of get those muscles prepared for, you know, what you're going to do, and to stabilize, you know, around the knee and the ankle, and just you know, again, maintaining good alignment of you know, the foot and the knee when you're squatting. So the next most common injury is slap tear in the shoulder. Now again, this is an injury that I will be doing a more specific video on, so keep your eye out for that one, and it will tell you about causes and symptoms and treatment, you know, and just generally go through that injury in more detail. So yeah, also you can subscribe, and then you'll be notified when that video comes out. So slap tear in sort of basic terms it stands for superior labrum anterior and posterior. So that's the part of the shoulder, you know, where the injury is. And it can occur both from acute trauma and also from repetitive stress, either from overhead lifting, so things like your deadlifts, but also in any sport where there's throwing. So things like, you know, shot put, and javelin, you know, would be good examples of sports where this is a particular, you know, risk. And it also is trauma that occurs. It's when that overhead lifting or throwing also involves, you know, full rotation of the arm as well. So basically, if you can't raise your arm without pain, you know, or without feeling that either one or both of your shoulders are weak, you may even experience like a popping sensation, or like your shoulders catching in certain movements, then it's really time to, you know, to see a medical professional. Some labral tears, they will heal over time, but, you know, some do require a more aggressive treatment, potentially surgery. So it's really important to get these type of injuries seen to quickly. But in terms of prevention, you know, you want to certainly, again, it comes down to, you know, warming up the muscles before working out, specifically your upper back muscles, and just focus on keeping that optimal shoulder position. So keeping the shoulders, you know, down and away from the ears, you know, when you're doing these, you know, lifting weights. Also, you want to avoid strengthening movements where your arms are placed behind you, and avoid anything overhead, where your arms are overhead, where you're getting pain. Just avoid it, because, you know, pushing through it again, it's just going to make it worse. So the best exercises would be things like incline dumbbell presses or reverse flies. They would be good exercises to do. Okay, so the next injury is tennis elbow or lateral elbow tendonitis. So this injury is often caused by overgripping, tends to kind of linger, which is a common characteristic of tendon injuries. Yeah, so it's otherwise known as tennis elbow because a lot of tennis players get this problem, and it occurs on the lateral or outer side of the elbow. And again, I will be doing a specific post on tennis elbow, which will give you more detail, so keep an eye out for that one. But symptoms, generally you're going to get an ache on that outer edge of your elbow when you straighten your arm and pull your arm towards you. You're going to feel a stretch along the outside of the forearm muscle, sort of just along here. So yeah, again, like with the Achilles tendon, this needs rest to be resolved, and in order to reduce the inflammation, do not push through the pain. You need rest, you need to reduce the inflammation before gradually strengthening those gripping muscles in your forearm again. Now you can alleviate some of the symptoms through massage and stretching exercises, but massage certainly should only be done when the inflammation has subsided, and any exercises, as you start doing exercises, should be really gentle exercises to start with. Certainly when I do the video on tennis elbow, there is an exercise called the Tyler twist, which can also be used in reverse for golfer's elbow, which affects the inner edge of the elbow. That's a really good gentle exercise to start off with. But in terms of prevention of tennis elbow, start the workout, with some gripping exercises to warm up not only those muscles, but also, warming up your entire body as well, while building that grip strength. Incorporating exercises, that involve crawling or push-ups can really help maintain the flexibility in the wrists, which will also help maintain flexibility in those forearm muscles, which obviously then has a knock-on effect on the elbow. Right, next common injury in weightlifting are hamstring pulls or tears. Now, when you've had one of these, because it is going to hurt. You are going to feel an immediate sharp shooting pain in the back of the thigh, which is usually caused by an explosive activity. So something like sprinting or jumping quite often will cause these kind of tears. But basically anything that, puts a high demand on those hamstring muscles at the back of the thigh will, it will be obvious when you have this injury. And again, I will do a post on hamstrings, and how to identify a hamstring tear, what to do, and how to prevent in more detail. Some of these tears on your hamstrings, they actually need a good year or two to really recover properly. And once you've had a hamstring tear, it's very common for you to get another one. You're going to be at a much higher risk of a second injury. So recovery is crucial you know, you have to do it right. But in terms of preventing, you know, maybe you felt you've got, you know, some tightness there in the hamstrings, so you want to start taking some preventive measures. Again, do a thorough warm-up, you know, if necessary, include easier sets of your exercises, you know, and in terms of accelerating, if you're sprinting, you know, just maybe sort of accelerate a little slower, you know, just to help warm those muscles up, rather than going straight on into that, like, you know, explosive, you know, use of the muscle. Obviously, generally make sure that you maintain as much flexibility and strength in your hamstrings as you can. You know, this may be through stretching exercises, yoga, or massage. Certainly strengthening them with something like a deadlift is great for the hamstrings. But again, if you're feeling any tightness there, just take it slowly, because you know you don't want to just suddenly sort of really push yourself hard and then, you know, end up with a tear that at the end of the day is going to take you out of the gym for a good year or more. So strengthening the glutes will also really help to support the hamstrings when you're doing something like sprinting or jumping, or even, you know, on things like those deadlifts in the gym. So that's another area to focus on. So the last injury that I'm going to talk about is another tendon issue. It's patella tendinitis. So your patella being your kneecap. So patella tendinitis is characterized by pain at the patella tendon, which is just below the kneecap. Again, as with the other tendon injuries, it needs rest so that you can reduce that inflammation and then gradually build up the strength and flexibility, you know, without risking it flaring up again. You know, recovery, it's, you know, it has to be done properly. You have to just progressively build the load on your quad muscles, on the tendons around the knee joint, with eccentric exercises, and that will help to reduce the risk of, you know, any further injury. If your pain is at the front of the knee, you might want to look at how you squat, just the alignment of the knee with the foot, and just make sure that you've got correct technique. And again, I will be doing a video on some specific injuries, one of which will be squatting, and I will be talking about optimal positioning when doing those exercises in order to reduce the risk of injury. So that's another one to look out for. You know, I know there are some people that may kind of vary in their attitudes towards the sort of knee-foot alignment during a squat. I would say keeping the knees just behind the toes during a squat will decrease the stress on the knee. But it's more important that the knees are correctly aligned with the hips and the ankles. So when you're looking at the leg from the front. So ideally, the middle of your knee should be roughly over your second toe. And if you practice, you know, proper form when doing squats, this will really help minimize also other stresses to the knee joint, which may occur, you know, if your knee is kind of caving inwards during a squat. So in terms of preventing patella tendinitis, as we said, just, you know, in terms of squatting, keep the knee, the middle of the knee in alignment with the second toe during these exercises, whether it's lunges or squats or step-ups, whatever it may be. And this will help to reduce the stress on the knee joint. Also working the glutes, ensuring that the glutes are strong and will stabilize the hip, will really help to consequently reduce the stress on the knee, and will also strengthen the hip muscles, which, if you think your main quad, the rectus femoris, that crosses the hip and the knee. And you've also got the IT band running down the outer thigh, which again runs from those glutes down to the knee joint. So by strengthening the glutes and the hip muscles, this can also help, with hip stabilization, and also stabilization of the knee when you are doing things like squats and deadlifts, and therefore helping to take some of the load off of the knee joint. So by incorporating key exercises into your workout and focusing on proper form, you can reduce the risk of injury. Starting your workout with a proper warm-up, correcting any muscular imbalances, whether it be through exercises or massage, and just, thinking about flexibility, not just strength of the muscles, but think about keeping those muscles flexible, really will go a long way in reducing the risk of injury. And again, this is another thing that massage, regular sports massage can really help with. Sports therapists like myself, certainly it's not just about releasing tight areas in the muscle. It's also about, doing maybe passive stretches to help reduce the risk of injury and maintaining the flexibility of those tissues so that you don't get these injuries, hopefully. So those are the main injuries. As I've said, on some of those, I will be doing more specific, more detailed videos, so keep your eye out for those. Any questions, feel free to ask in the comments section, or contact me through my Facebook or Instagram, which I believe there is a link button somewhere down here. And feel free to subscribe to my channel, and that way you will be sure not to miss out on any future videos on some of these sports injuries that we've talked about.